This session is Unique Jobs in Healthcare, and we have two amazing panelists here today to talk to us about their professions. And yeah, but before we start, let me give a brief rundown of what ScienceHolic is as an organization. We are a youth-run nonprofit that aims to introduce intricate scientific concepts in a manner that is fun and comprehensive to teens. Our main purpose and our mission is to serve as a free resource for students to learn more about various STEM topics. And we also aim to provide opportunities for students who have English as their second language to expand their English ability and to provide unique volunteer and leadership opportunities. We have several sub-branches, which include our seasonal magazines, monthly webinars, and a newly established bi-yearly review, which I'll talk about later, and along with our monthly blogs, articles, and find some scientific facts. I realized that I forgot to introduce myself at first. So hello, everyone. My name is Scarlett. I'm from Hong Kong. I'm the Communications Director of ScienceHolic and also the host of today's webinar.
Hi, my name is Jessica. I'm an ambassador for ScienceHolic, and I'm also a member of the outreach team.
Hi, this is Joyce. I'm the co-founder of this organization, and I hope you guys enjoy today's workshop.
That's good. Now, without further ado, let's introduce our amazing panelists for today. Risa, would you like to go first?
Sure. So my name is Risa Brown, or Risa. I'm a clinical laboratory technologist, and so basically I work in a molecular diagnostics lab, and we do cancer testing for research throughout the US and all over the world. And on the side, I like to do content creation. I graduated from University of Maryland. I have a degree in biology, and I've been doing this for a little over a year now, so fairly new into it.
Great. Sally, would you like to go next?
Yeah, sure. Thank you everyone for joining us. My name is Sally and I am a certified anesthesiologist assistant. So I am part of the anesthesia care team and provide anesthesia to patients undergoing surgery. And I graduated from Emory Medical School in 2017 with the degree in anesthesia. And before that, I was a exercise and sports science major at UGA, University of Georgia. So I've been working as an anesthetist for about 3.5 years now, and it's fun. I love it.
Great. Before we begin, to the attendees, if you have any questions, please send them in the chat. So we'll try to go over them at the end of the webinar if they haven't been answered already. And then without further ado, let's move on to our first question. So, like the namesake of the session, why this career? Why not a traditional path to healthcare, be it, a doctor or a nurse or some the typical names that you hear as a child? And did you study to pursue a traditional job first?
I can go first, Scarlett. So typical Asian parents, they wanted me to be a doctor. My undergraduate route was pre-medical. So I took the MCAT, did all of the pre-medical courses and classes, biology, OChem, chemistries, and ended up working for an orthosurgeon. And during that time, I realized that orthosurgery was not the life that I wanted after seeing, him in that environment. So he actually had an anesthesiologist, and he was the one who introduced me to anesthesia. But this route, CAA, it's not traditional because not a lot of people know about it. And it's a 2-year program similar to being a physician assistant. Have you guys heard of, being a PA? Yes, it's the same 2.5-month program, and you get out, you get your master's. But the only difference is it's specialized in anesthesia only, whereas a physician assistant can do any sort of specialty. They can do general, vascular. They can specialize in those different specialties. AA is only for anesthesia.
And so for me, I also started, I guess you could say, with the traditional path. When I entered undergraduate, my initial was to be pre-med and to go on to be a doctor. And then about halfway through, I kind of changed my mind. I just wasn't sure if I wanted to do that. after I graduated, I decided maybe I should try nursing. So I was going into an accelerated nursing program, took the HESI, got in, passed all the classes, and then I again changed my mind. During undergrad and during the nursing, you kind of take you do a lot of lab work, obviously for chemistry, biology, anatomy, and phys. And that's something that I really enjoyed. That was probably like my favorite part of being in undergrad, of my classes that I had to take. So once I kind of stumbled upon being a clinical lab tech or working in the type of lab environment, that's something that I decided to pursue. And so I enjoy it a lot. It's something that kind of like what Sally was saying, it's not uncommon, but you just don't hear it talked about a lot. And a lot of the times, even those type of jobs are also like very, very important. So you still feel like that fulfillment, even though you're not a doctor or a nurse or like the main type of name that you hear most of the time.
Well, that sounds good. So how about let's start deeper into these careers for a little bit. But you both touched upon this briefly, but how did you learn about your current job? And how did you know that this is something you wanted to pursue? Because I'm sure because both of your professions aren't much heard of in media, how did you find out more about these jobs before deciding that this is what you wanted to do?
The anesthesiologist that worked for the surgeon that I worked for introduced me to the job, and I just Googled it, and up came a few programs. There's not a lot in the US, maybe 7 or 8. And with this profession, it's actually, you're only allowed to work in 17 states of the United States, like of 50. So it's also limited in that aspect. But I just Googled it and the programs came up, and there was one 20 minutes away from where I lived. And I was like, okay, that's where I need to be, because it was convenient for me. And it turns out that Emory is the first one that started the whole profession. So a lot of deep roots within Georgia and Atlanta. And within that, because of that, all the hospitals in the area are heavily anesthesiologist assistant based. So there's a lot of people that are AAs in Atlanta. And I knew I wanted to do it because it's a 2-year program, and you graduate. Most of the time, people already have jobs before they even graduate. So there's not a lot of like, if you graduate, you have to search and look for a job. There's none of that worry, because there's always need for AAs. And you graduate and you start working, and it's just a very direct path to anesthesia. Whereas if you go to medical school and become an anesthesiologist, that's 4 years medical school, 3 years residency. And not only this residency is 3 years, but you have to match. So if you don't match with a certain program, then you don't end up doing anesthesia. So that was a risk I didn't want to take, and I just knew anesthesia was for me. So it was more direct.
Similar for me, once I had someone recommend it to me, actually, because like I said, in nursing, I started to kind of change my mind, and I didn't know what type of direction I wanted to go in. And someone recommended just looking up or thinking about working in the lab. So I just did a ton of Googling. There are programs specifically for this. I just have my biology degree. So it took time to actually find a place to work at with just the biology degree and not a certification, but it's definitely possible. And so that was something that I enjoyed, was that it was a possibility to just use my bachelor's for now. And then in the future, if I decided to pursue something else, I could make that choice then, instead of trying to rush and figure out what I want to go to school for next. So I just did a lot of Googling, talked to a couple of people who I did find in the position, and then just went from there.
Would you say that finding people, in the same profession to talk to and, getting to learn more about, what they do, would that be helpful to finding more about, the profession you wanted to go in?
Oh yeah, absolutely. I highly recommend talking to multiple AAs prior to, you need to shadow them prior to applying, you need to find out if this is the life that you want, because it's a pretty big investment. So it can be a little difficult because it's such a niche profession. But once you find one AA, they know all the AAs. So they'll be able to contact you with, everyone else who is in the profession.
Moving on. Can you speak about some different paths, someone can take with a common pre-med, like Risa's biology degree, or maybe, well, because Sally, you have a more unique degree for your bachelor's, some different paths that one can take, out after the bachelor degree in healthcare.
Yeah, so my major was exercise and sports science because I wanted to become an orthosurgeon, and that is the route that I chose to take. However, with the program, you can have a bachelor's degree in any subject. You can do history, major in history, and as long as you have the prerequisite courses taken, then you can apply, and that doesn't hurt your application or anything. It actually, I would say it helps because it shows that you are a person of variety, and you're able to handle different topics and different interests. You're not all science and math. You're a little diverse. So it's one thing that's pretty great about the profession and the program is that it doesn't limit you to only the typical biology degree. So if you have a passion somewhere else and you enjoy it, I'd say, go for that degree and then just take the prerequisites.
Yeah, I don't have much to add. I completely agree with that last bit because I do have a lot of friends who, since I was pre-med, I do know a lot of people who still wanted to go, are going that pre-med route, and they didn't major in like biology or chemistry. They definitely majored in like public health, business, things like that. And then even just kind of going back to what we were saying earlier, just Googling, like doing a deep dive and figuring out, like maybe if I want to major in biology, for example, just doing a deep dive and seeing what you can do. You can be a lab tech, you can do forensic science, you can be a biological tech. So there's different paths you can take. And then like going off of what Sally was saying, you don't have to stick to that path. If you find something else that interests you, or want to take extra classes, you can go in that direction as well.
Mm-hmm. Because when it comes to healthcare, there's so many different paths and varieties, and within these small paths, so many different specialties. So we'd like to talk that the purpose of this session was to shed light more about these different paths, and that is not just a typical doctor and nurse that students can consider.
Oh, something I want to add, Scarlett, is that in our program, during my class, it's a lot of people have already had, careers prior to applying. So in my class, I've had a person with a PhD or a person who was an engineer prior to, and then they decided to switch and become an AA. So it's, you can pursue whatever you want and end up being an AA later.
Mm-hmm. There's a pressure for high school students to decide their paths, high school, college students to decide what they want to do so soon. And then, they say change, to pivot, it might come with a negative connotation sometimes. So this is also a good thing to talk about, the different varieties one can take. Moving on. So how can someone learn more about these non-traditional paths early on and see that they're good fits for these paths, because again, both of you, I believe, haven't heard of your professions even, much later, maybe not, definitely not in high school. So maybe late college years. So how can people learn more about these professions?
With the oh, sorry, Risa, you
No,
go first.
you can go. No, it's fine. You can go.
Okay, so with AA, I would say you really have to try and get shadowing hours. I know it's very difficult right now, especially because of COVID. All of the hospitals have pretty much said no to any shadowing student. But there are different avenues of anesthesia. I mean, not only do surgeons need anesthesia, but dentists need anesthesia, when they do involved procedures in the mouth. So you can contact dentists because they are able to provide a limited amount of anesthesia. Their scope is smaller, but you can get exposure that way. And secondly, veterinarians, animals. So when animals have surgery, they also need to go under anesthesia. And that's another profession you can contact to try and get a little bit of exposure to see what we actually do. And it's a little similar. I know it's on animals, but the concept is a little bit of the same. And we've had vets who had that work experience, and applied to become an AA, and that's what they talked about during their interview. So it's interesting. And I think those are really the two alternatives. I have a YouTube channel that I try to record and show you guys what my day is like. So check that out. But I don't know, COVID makes things very hard right now. So
I understand.
And then I would say kind of just asking around. So even, for example, if you're just at your primary doctor for a checkup, maybe just ask them about anything you've came across, or a lot of times other people will know different paths that you might not have heard of, and they can recommend you people to talk to, people to shadow. So I would just say, if you find something or you see someone who, not even if they're not necessarily doing what you want to do or what you think, just ask them, kind of like how we're doing today, ask them what it's like, how they got there, what did they do, and if they have any recommendations, if they have other careers that you could possibly be interested in. There's so many things that you just don't know about. And like you were saying earlier, especially when you're in high school, I never heard anything about a CAA or being a lab tech. So it's good that you're starting early and kind of getting the word out. And I would just definitely say networking. So just asking people, it doesn't matter where you are, like if you're at the dentist, like she was saying, or if you're at your doctor, you're in the hospital for some reason, you can ask someone, and I'm sure they're happy to tell you about what they do, how they got there, who they recommend, and things like that. So yeah.
Mm-hmm. Okay. So you would say networking is the most important aspect of it?
Oh, like networking. So just talking to people and making different connections, like kind of like business connections in a sense. So yeah, if that makes sense.
It might be a little bit difficult for high school students to do that, but we'll keep that in mind. Despite both of you having really different professions, would you mind talking about briefly what your typical day or schedule looks like? We're all would like a good work-life balance between our work and social life, and you sparing your time to talk to us during this conference. And how do you manage your time between your different roles?
I'll talk about a typical day. And typically you'll wake up at 5:30 in the morning and drive to the hospital, change into your scrubs, and set up your room. You're assigned a specific OR the night before. So you go to your room, set up, make sure you have everything you need for that case. There could be multiple cases in your room or just one long one. It varies. But first case starts typically begin at 7:30 in the morning. And typically, it just depends. Most people will work 12 hours and then others will work 10 hours. And as long as you have 40 hours total within the week, then you are set. And that's like the best thing about being a CAA, because work-life balance is so easy to encompass. You don't have to work hard, long hours if you don't want to. And you can work as many hours as you want to. You can fit 80 hours into one work week if you are gung-ho and you want to make a lot of money. You can work that. If you want, the hospital will allow it. But we have moms at our group and they only work 32 hours a week, and that's it. So it's very flexible. But I will say it depends on the hospital that you work at. Some are more stringent than others, but it's variable and it will cater to whatever your needs are. So very flexible, and that is one of the highlights of this profession.
So for me, like I mentioned a little earlier, I work in a reference lab. So I don't work in a hospital, and I work at a lab that's really only open Monday through Friday. I specifically work 8 to 4:30. And so we get assigned different rooms for each month. We have about 8 different rooms, and each month we're in a different room, and you kind of work a lot independently when you're in the room. But you're working on projects as a lab as a whole. So basically you kind of know what you have to do the next day. So I know if I have to start a run, I know if a sample is priority and I have to like get it pushed out. If I'm slow in my room, I'll go pick up another room and help someone out. And because we are a smaller lab, we also have to do different clerical duties. So there's a lot of scanning and filing and emails and making sure things are documented correctly and doing stock and ordering and things like that. So it's a lot that goes on, but everyone is very helpful. So it's easy to, you're not too overwhelmed. You're not gonna, we don't really have a lot of people who are like breathing down your throat all the time, making sure that you're doing what you're supposed to be doing. You do have that bit of independence where they put their trust that you know what you have to do for the day. If you need help, definitely let someone know. If you're behind, let someone know. Someone will help you. So it's a lot of independent work in the lab specifically, but as a whole, everyone's there to help you. So it's a really good balance. Like I said, I work Monday through Friday. I'm on call every other month on one Saturday a month. So it's really really easygoing. It's a little bit of pressure, but nothing like, too major. So I really enjoy working in a reference lab.
Mhm. Would you think the workload every day it's decent, all right, or was it what you expected when you first joined the profession?
The workload, yes, because during the program, your second year, you are in clinical every single day. So you see what work is like. So you're used to it when you begin actually working yourself. However, days can vary depending on the universe. If it's a bad day and there are a lot of emergencies, a lot of bleeds and ruptures, then you're going to be working a lot and it can get stressful. But then I have had days where there are no emergencies and I get assigned to a very easy bread and butter case. And it's like, oh, wow, anesthesia is like very chill and it's relaxing. You're not stressed. So you have ups and downs, and it's just, you never know what your day is going to be like. It's always a surprise.
I would say for me, the workload is more than I expected in the sense that, as I just mentioned, there's other things to do besides just being hands-on in the lab. And so, for example, for today, we were extremely busy because we had like 3 people who were off today, but work still had to get done. So it was a lot of going back and forth. But once again, it's kind of like, you have help. So it can be a lot sometimes, but there are days where we have a lot of time to sit and talk and, joke around. We still have those breaks. So it's not always like high intensity all the time, every single day. So like Sally was saying, some days are like super busy like today. And then there's other days where we all go out for lunch together because we just all have that, we have that downtime for that day.
That sounds good. But did you think your education and your training, the programs you enrolled in, prepared you well for, the real reality that is your professions, that had sometimes, hectic days filled with emergencies? Do you think your programs prepared you well for that?
I think once you graduate, you know the basics. of, you know, what to do in an emergency situation. But until that actually happens to you, when you're working, you do feel stressed and you do feel a little bit lost. But once it happens, you've seen it before, you know what to do the next time. I'll say when you graduate, you're just okay at everything, and you learn so much that first year. I mean, your education, I think, is like goes like this that first year, and after about a year and a half, I think everyone is comfortable with any type of situation. So it does take some time still after graduating to be okay.
Yeah, there's definitely a learning curve because graduating with just the biology degree, and like I said, I didn't go through like a typical clinical lab degree or program. I was really nervous starting, thinking, you know, what if I don't know how to do this? What if I don't know how to do that? I was just like overthinking. But like Sally was saying, you have the basics down. Like you've worked in the lab before, you've used many different instruments, you've done lab work by yourself in college, you've read procedures on your own and followed them and asked questions, and it's literally the same. And your job is going to teach you what you need to know. Like I said, I was super nervous and I'm like, they're gonna think I don't know anything, but they're willing to teach you. Obviously, you aren't gonna know everything because every company is different. Everyone has different procedures. So it's expected that like, you're gonna know the basics going in. So I would say I was like prepared enough to go into my job and be successful. And then like Sally was saying, there's just like such a learning curve once you actually get into it, and everything just starts to click and like you just flow through.
Yeah, and then to add to that, you always have your attending anesthesiologist assigned to you. So you can always call them for help if needed. You can call all your coworkers if you need help. So your anesthesia department is a whole team, and we're there to help everyone take care of the patient. Patient care is number one. So we'll do anything and everything to make a patient, you know, stay alive. You know, we won't let them go. We try not to. We try our hardest not to let them go.
Moving on. I believe this either the last or the second last question, but what advice would you give to high school students who are considering in a career in STEM? That was a mistake in the brackets. I'm sorry, please disregard that. In the STEM fields, you know, maybe they want to pursue a more traditional career, or they want to pursue a unique one, be it in CAA or clinical technology and all that. So what advice would you give to high school students?
I would say you really have to figure out what you are passionate about. If you are extremely passionate in medicine, become a doctor. That's like the ultimate goal and career you could have, and your potential is limitless once you're an MD. There aren't a lot of restraints to an MD. However, if your goal is, you know, just to get a well-paying job, start your family early, and, you know, have that work-life balance, if that's your main goal, then you can start seeking out other professions, other ways of being still in the medical field, but having that extra work-life balance as well. Not that doctors don't have the work-life balance, it just comes a little later. But it's just so early for you guys, because you guys are like high school students, so it's hard to know. I mean, who's thinking about families when you're in high school? You know, you're not even married, or you might not even have a boyfriend yet. It's kind of too soon. I would say just enjoy your life, guys. Do whatever makes you happy.
Yeah, I think my advice would, I think Sally mentioned it earlier. Don't be afraid to change your mind, because like she said, you guys are so young. And at this point though, you have connections at this point. You have Sally and I that you can ask for advice or just any type of questions that you have. And we can point you to someone in the right direction. Don't be afraid to change your mind. I could want to go back to school one day, and like I think that's completely fine. You have time. You don't want to rush into anything. I definitely wish that I hadn't like been so gun-ho on like, I guess pre-med in the beginning. I wish I had explored more options or talked to more people. So I would really say that's honestly it. And then also, again, Sally mentioned this earlier, don't be afraid to do a different degree because like I said, there's so many people who I know who went into dentistry or in the public health sector or just taking a gap year and they didn't do like a biology degree or chemistry degree or engineering degree. They did what they wanted to do and then they just made sure they took like the prereqs in case they did want to go to med school or something like that. So I think that's something that a lot of people don't know is that you don't have to major in one of these degrees. As long as you can take those extra classes, you're fine. You can major in whatever you want to. So just explore different things. Don't get deterred or straight-eyed on like just one thing that you may think that you want to know because things could change.
Mm-hmm. Yes, it's very valuable. I feel like there, as I mentioned before, the pressure for high school students to decide on one path so soon sometimes limits us to different options. So that's why this conference we wanted to talk about some more variety when it comes to healthcare. And thank you for your advice. It's very valuable. We might be a little bit ahead of schedule, but I think it's okay. Right now, to the attendees, if you still have any more questions, please send them in the chat. And I see that there are a few. So Angela asks, probably to Sally, what's the difference between CAA and anesthesiologist?
Anesthesiologist is it's the route that you take. So anesthesiologist, you go get an undergraduate degree, apply to medical school, graduate from that and get your medical degree. And then afterwards, you have to apply and match to a anesthesia residency. And that's typically 3 years. So after that, you become an anesthesiologist. Now, a CAA is similar to a physician assistant. It's 2.5-year program and you end up with a master's degree. But the relationship between a CAA and an anesthesiologist is that the anesthesiologist will supervise CAAs. So they can oversee 4 at a time. So there'd be 1 anesthesiologist and 4 CAAs in each different operating room. So the anesthesiologist will go in and out of each room and just, check to see if everything is, working well, the patient's safe, and they'll just monitor. They'll be there for the beginning of the case and plus minus the end of the case. So anesthesiologists, depending on the state, can work with CAAs or they can be in their own operating room as well. Does that make sense? Is that a little clear? You can type in the chat if you want me to go more in depth with that.
While she's doing that, I think there's a couple more questions addressed to you.
Sure.
What personal characteristics would make you a good fit for becoming an AA?
Yes. So something about anesthesia is that surprises can happen at any moment. And I think to be a good anesthesia provider in general is that you should be able to handle stress well. If the patient is, the surgeon nicks a vessel and there's massive blood loss, you cannot panic. You have to know what to do and systematically do everything so that you can keep the patient alive. Because if you panic, you can't think. And in the operating room, it's a matter of seconds and you need to be able to give drugs, give blood very fast. So if you handle stress well, anesthesia is for you. There's some people you'll work with and you'll be able to see like, oh, she's a little nervous. And for those people, I don't know, they get the job done. I'm sure, you know, they've studied well and they know anesthesia, but as far as the work environment and interactions with the surgeon, the nurses, everyone else in the room, you have to remain calm, because if you freak out, that freaks the surgeon out and everyone in the room freaks out. So we just need to stay calm to calm everyone else.
I think there's a question that I think both of you can address. So what are some of the most rewarding parts of your job, and what are some of the most difficult aspects?
I would say some of the most rewarding is kind of, I mentioned earlier, is that these type of positions aren't like at the forefront. So you're not going to hear them talked about a lot, but knowing that either way, you're still helping. I don't have direct patient care, but I know that I am involved in research to progress clinical research for cancer patients. We test for so many different types for like, we do head and shoulder, we do lung, we do melanoma, and we're helping these doctors basically, you know, try and find a treatment plan that, you know, in the future at some point, like it's going to be worth it. So I think that's the fulfilling part, is just knowing that you're helping not everyone, but you're helping a lot of people, even though I'm not directly working with them. And honestly, I think the most difficult part is honestly sometimes seeing the results. We have patients who are doing screenings, so they don't necessarily know that they may or may not have cancer. So I would say, honestly, that's probably the most difficult. You get a little more, I guess, in a way used to it, but I think that's the most difficult part sometimes, is just seeing people's results and knowing that they do have these different diseases, and then they are trying to enter treatment. Sometimes we get emails from doctors saying this patient has to pull out because they progress so fast. So things like that is difficult, but you just kind of got to keep pushing through it.
Sorry.
Right.
Go ahead.
Okay, another rewarding part about anesthesia is that it's instant gratification. You give drugs and you'll see the results happen within a matter of seconds as well. And it's very hands-on. So you'll be able to insert IVs into patient's veins. You'll insert arterial lines into the artery of the patient. You will intubate every single day for patients that need intubating with general anesthesia. And then you'll give drugs to patients. You'll give pain medication, you'll give anti-nausea medication, as well as control their blood pressure. And all of that you do, you can, like, it's the cause and effect, and you can see it immediately. And once an operation is done, you wake the patient up. It's like, oh, wow, this patient just had surgery. We, you know, we're a significant part in their care, and it's been completed, and you can see that end, which I really like about anesthesia. Whereas with orthopedic surgery, for instance, that's what I was interested in the beginning. With orthopedic surgery, it's like a patient will have surgery, will need to get casted for a period of time, and then go through physical therapy for 6 to 8 weeks. And then you see that recovery, and it's like long and drawn out. And sometimes the patient doesn't even recover 100%. So that's what I don't necessarily favor, and drew me to anesthesia.
Could you also speak briefly about what's it like to work with others in the operating room? Is it stressful? You know, what is the environment like?
In the operating room, it depends on the surgeon. You'll notice that there are many different types of surgeons. Some are so nice, they ask you what your name is and get to know you and communicate very well. Whereas others are a little more, I guess, have a little bit more attitude and demand a lot of things without, I guess, respect. At my hospital, we tend to filter those surgeons away. And then currently everyone's been great to work with. However, you will come across surgeons who are, very needy and very stern, and you can't let that get to you personally. I'm sure they just want to take care of the patient and do things in a very fast-paced environment, and you just have to keep up with them. They're not attacking you, and you don't need to take it personally.
Seeing at the time, we have 4 more questions, so we can go through them quickly. So what is a physician assistant? I believe this is Sally again.
A physician assistant works for a doctor with an MD medical degree, and it's a 2.5-year program. You apply with, they require a good bit of clinical hours, I will say, and it's the typical science courses for prereqs. But once you become a physician assistant, you are able to work in a variety of specialties. Dermatology, you can be a vascular surgical PA. You're pretty much limitless in areas that you can go into, but always know that you're going to be working under a medical doctor. And it's a great alternative to becoming a doctor. I've done a couple of cases where the physician assistant is closing on a patient, and they do pretty much what the doctor does. They help out. They get a lot of responsibility as well. So check that out if you're interested.
That sounds good. This is Teresa. What is Risa? Sorry. What is the difference between a clinical lab and a regular bio lab? And do you guys work with hospitals?
The clinical lab is, like I was saying, I do research. We do research for like clinical testing for cancer and things like that. A straight biological lab, you're kind of doing, I don't know how to say this, like you're doing things that you learn in biology. So you might be dealing with research for maybe animals or plants, or it could be people as well, different things like that. It's not limited to just one thing. So for example, if you're working as a medical lab tech, you are basically doing the same thing. It's all the same thing. It just depends on where you are. So my lab specifically does clinical research testing. If you are in a hospital, you could be doing regular testing for like, regular as in like urinalysis, blood testing, tissue testing, things like that. It's not narrowed down to one thing. So when you have like these different names like clinical lab, biological lab, medical lab tech, it's just kind of specific to where exactly you're working. So it's not, but it's all under the same thing. You're still working in the lab itself.
Mm-hmm. And what is one, or let's say the most shocking thing you've learned through your experience as a clinical lab technologist? And is there anything in your job career that you were not expecting when you first joined?
Something shocking. I'm not sure if there's anything too shocking. You get very odd samples sometimes. So we get blood samples. Most of the time, that's how we do our testing. We take them from actual blood. You get different blood samples. I would say, I don't know what the most shocking thing is. I think the most shocking thing is making a mistake and then finding out, like you kind of panic at first. I think that's like the biggest shock sometimes. You make a mistake, especially if it's your first time, you like panic and you're just like, oh my gosh, what am I gonna do? Like this is someone's actual DNA, this is someone's actual like sample. And most of the time when you tell like a higher up, they're like, oh, this has happened before, this is how you fix it, or this is how you go about it. So you kind of have like a sigh of relief. But since I don't work in like a hospital, I work directly with patients, I don't have like too many like shocking or out of the world stories or anything like that.
Mm-hmm. Well, I guess that's a good thing then. Then you're very much prepared and calm most of the time when you're working. Our last question, I think. Sally, did you have a career before applying to your program? And did you apply right after you finished your undergraduate studies? Bree, I think is worried that not having any clinical experience will set them back.
Gotcha. I did apply during the beginning of my senior year. So when I graduated, I went straight. I graduated in December, a semester early. So I had about 5 months prior to just like myself, and that's when I worked for the orthopedic surgeon. But right after that, I went straight into the program. So traditionally, if you do 4 years of undergrad, you would graduate in May and then start the program in June, July. But since I graduated a little bit early, I had some time to work. And I will say programs nowadays do lean or favor towards applicants with any medical work experience. So if you don't have a job right now that's in the medical field, you can always volunteer. Volunteering is a great way to gain experience. And during my undergraduate degree, I volunteered as a scribe. And if you don't know what a scribe is, it's you follow the doctor around and you type pretty much everything that they say into the patient chart. And you outline, what the patient has, the diagnosis, any labs or findings, and then you type out, the medical treatment plan. And then you start to order anything or prescribe anything that the doctor needs. And all of that is written into the chart. So as a scribe, you just, you get exposure that way. What else can you do? Do you guys have any other professions or volunteer work that's medically related? Scarlett, Jessica, are you guys doing anything like that?
Not as of right now, but I'm planning to look into them.
It is kind of early because this was when I was senior year, so I was a little bit older. High school, they might volunteer. You could always go to the hospital and volunteer as some of the people that help nurses out. So they'll get the patients ice and water and warm towels.
Mm.
But at the moment, I don't know if that's an option because of COVID. So COVID is not helping you guys out.
Actually, personally, I'm curious as to how COVID-19 has affected your jobs. Has there been significant changes because of the pandemic?
Gotcha. At the beginning, when it just started to take off in the US, since we intubate so much in every single day, our department got converted into the airway team. So for patients that had COVID and went into respiratory distress, they needed to be intubated. So we were the ones going into the rooms, going into ICU and intubating the patients. That was one thing that changed significantly. All elective cases that didn't need to happen, like cosmetic cases, cases that aren't urgent or emergent, got canceled. And we did only emergencies and intubated. And that was our role at work during the peak of COVID.
I would say for me, our lab was mainly impacted by people being able to, I guess, go in and get their blood drawn for their sample testing. So I actually started right in the beginning or middle of COVID. So I would say samples kind of dipped. We saw a big slow in samples, and we were getting basically a lot of emails from doctors that a lot of their patients weren't able to come in. Typically, similar to what Sally was saying, because it wasn't necessarily like, I guess, an emergency. So they didn't have the option to just come in every 2 weeks to get their blood drawn. So I would say our sample, like our busyness, I would say, of the lab went down. But now it's kind of bounced back. We're a lot busier. We're busy every single day, and everything's kind of back to normal in the sense of like how many samples we receive. But I would say that was really like the only impact that we had, being that we're just a lab that doesn't work directly with the patients.
Sally, did you have experiences working directly around, COVID patients And if so, was it stressful?
Yes, so we have direct contact with COVID patients. It was stressful at the beginning because we weren't sure of how much protective gear we should wear because we didn't want to catch COVID as well. But now the hospital has systematically given a protocol to us. So we gown up, we double glove, we wear the N95, we have eye protection, and then we cover pretty much all of our hair is pulled back. So with that, I do feel a little safer. I've intubated multiple COVID patients and I haven't caught it. So that's a good thing. Fingers crossed, because we're still doing COVID cases. The thing that is a little bit more stressful than just regular airways is that if a patient needs surgery and they have COVID, you are stuck in the operating room with that patient for however long the surgery is. The surgery can be 5 hours. So you're in that room with constant exposure for 5 hours. And that can be a little hard because it gets hot and you don't want to touch your face because, you're touching the patient. And if you touch your face, then you're contaminated. So it's kind of a little difficult to try and stay clean, but I've done many COVID cases and I haven't gotten COVID. So it's okay.
That's good.
We'll be all right. Yeah.
Ending the webinar on a good note then. We haven't caught COVID, even though we're meeting COVID patients on a regular basis, is it?
Well, it's kind of died down now a little bit, but we are seeing more patients coming in with COVID and needing to be intubated. So it's sort of ticking up, but I haven't had to do an actual case in a good bit.
Well, that's good then. Okay, we're almost out of time, so I'll quickly wrap this webinar up. As you can see on the screen, here is our panelist contact information. It's also sent in the chat. So if you want to take a look at our panelists' Instagram and YouTube videos, you can check out the links in the description. Not description. I'm pretending I'm in the YouTube video now. In the chat, in the Zoom chat. So that's that. And not to do some shameless plug, but here are ScienceHolic social media accounts. We're mostly active on our Wechat account now, because our Instagram to get it back. Check us out on some other platforms as listed here. And finally, if you want to work with ScienceHolic, to our attendees, feel free to do so. You can screenshot the screen and scan the QR code for later. And basically, you can join as a team member in our various teams, become an ambassador like Jessica, who has been instrumental in helping us organize this conference. You can submit your articles for a blog or magazine and be part of our ScienceHolic review, which we started as a way for high school students to publish their science research papers, since we saw a lack of it, in lack of the opportunities for us to publish our papers. And finally, you can join our mailing list with ScienceHolic updates, such as this conference, delivered straight to your mailbox. Everything is linked in the Zoom chat, so all the links are there, and please scan this QR code if you're interested as well. So yeah, this is the end of the session. Thank you, Sally. Thank you, Risa, for joining us today and spending your precious time with us. It was the information you gave us was all very valuable, and we really enjoyed the chats today.
Thank you for having me. I really enjoyed being here. I learned a lot myself, so I really enjoyed this too.
Yeah, thanks you guys for setting this up. I'm excited to see, and I don't know. I just wonder what you guys are going to end up doing, because life is so precious and you're so young. I'm jealous.
We're aiming for greater heights. So yeah, we're also looking forward to see what we can accomplish in the future. Yeah. Thank you, attendees, for joining. We hope you've enjoyed the session, and please tune in again tomorrow at 7 p.m. EST for our Lives as Medical Students session. And yes, thank you so much. I'll see you all tomorrow, hopefully. Thank you, Sally. Thank you, Risa. Thank you, everyone. Have a good day.